Hi, everybody. My name is Richard Giguere, and this is my presentation on patient access to their medical records. Um, I decided to call my presentation The Promise or Pitfall of EMR Access. When I first read the title of this project and read what the presentation was supposed to entail, my first initial reaction was one of no way. Um, having patient having access to nurses' notes has always been, especially as a director of nurses, something that makes me nervous. Um, but as I approached this subject and read about it and did my research, my opinions began to change. So let's get started. So to review some of the history of how we have gotten to the point we are today, I guess it's important to talk about the concept of the e-patient. So as the book kind of goes on to describe, which was kind of surprising to me, that the term was originally put together back in 1975. And that seems just amazing to me because back in 1975, the whole concept of computers was still sort of its infancy. So I guess there were some very innovative people thinking about this and the possibility of what could come through technology in order to help facilitate records for patients. And so, as you can see in the timeline here, the term e-health was introduced in 1999, which was kind of more specific about electronic charting and the information technology used to facilitate that. And then moving up through today, where in the text it talks about e-health sort of not really having a very clear definition anymore. So as we start thinking about how this is evolving and the speed that it's evolving at and the possibilities that it's presenting, I think that that's something that we're going to have to sort of come to grips with as we move forward. The text also does a really good job of reviewing the evolution of online health. So it goes through the three different versions, which they called Web 1.0, Web 2.0, and Web 3.0, talking about how in the beginning it was really more of a storage unit that was set up for keeping health records that didn't really have a lot of interaction. Uh, it was just really a warehouse of information. But then as it moved into this Web 2.0, it started being something that was a little bit more interactive. More and more people were starting to get online access, and it was starting to create communities where people could talk about their health issues and start kind of looking things up. And then we kind of moved into this Web 3.0, where we're sort of moving into this system that's a lot more personalized to patients and to what it is that they can do with this information. And also the ways that this information can be accessed, especially through mobile devices now, is really opening up this window of possibilities for patients and getting access to their records, which is important. I think as healthcare workers, we realize how often patients are asking questions about what's going on with them and their conditions and their medications. So this is another tool that we can use to let them have that access. So speaking about that access, so one of the things that has really facilitated that situation for people to have access to their EMR is the evolution of the web. I can remember when there was a modem and dial-up access and the painstakingly torturous long process of having web page load. Um, but none of that really is an issue anymore. Today, I think that we've gotten to a point where if there's even a slight hiccup, we sort of get impatient with the web. But it's come such a long way in terms of bandwidth and speed, and also access. It's not some. I mean, there's still a disparity there, which I think that's something that we have to think about when we talk about access through the web. In terms of access to the internet, but there are a lot more people today, and it's growing, that number that have access to the internet. And also it creates that immediate access to the information. It also in the text spoke about how the IOM report, Crossing the Quality Chasm, is really something that helped bring the issues that plague healthcare in terms of errors, and how the solutions through IT can really bring quality and safety back into focus with healthcare. So here in this slide, I just wanted to present the two sides. The initial pros were timely access to the information, catching errors in the records, so increasing safety, increased involvement in decisions on the patient side, hence personal responsibility for their own health care. And also through this process, it'll increase trust in healthcare and its providers. On the con side, there's the misunderstanding of medical information, people not really quite understanding what they're reading, and so creating more fear and anxiety related to that confusion. Also, that disparity in access to the internet, privacy issues that come up when you get access through the internet, and also the access to misinformation on the web. So in researching this topic, I found a study that really talked about, it kind of looked at a bunch of different studies, and kind of came up with some of the same pros and cons that I was thinking of on my own, as well as seeing in the text. And that some of those things that they talked about was incomplete transparency, when people don't have access to their records, increased stress that can come along with both sides of getting access and not having access, the pros and cons of having technological interactions versus in-person interactions, and how that can affect how people are feeling about their medical situations, that lack of empathy on the technological side. They talked about patient empowerment through that information, improve relationship with their caregivers, the convenience, and also it talked about, which I thought was a really great idea if we could kind of implement something like this, was a patient's healthcare diary that could be stored in the patient's records. So that way, as a daily charting is being done by a patient, then medical professionals can have access to that information. So here I talk about my personal experience as a patient, and having access to these records. I've definitely experienced on my own side delays in access to my lab work. I've found misinformation in my medical record. I have limited access as a patient to a portal, and that's a little bit frustrating when I know how much information is really in there. Missing information in my medical record I've found. And I've also had healthcare workers kind of get defensive with me when I start asking them questions about my medical. So on the other side, my personal experience as a professional, I see that there's what that looks like to have immediate access to lab work, and how quickly you can really get that access. And I've also had frustration as a professional with the misinformation. We have patients that come in, the chart says one thing as they're coming in the door in the paper, and as you kind of start talking to the patient and start looking into things, things are different. I get full access to a medical record as a professional, which I can see everything, which really opens my eyes to what it is that's really going on with somebody. And then there's also fear related to unprofessional documentation. When notes are sometimes written, they're written in this defensive, unprofessional way, which really turns my stomach when I read that stuff. So that's one part that makes me nervous about this. And then Also, having patients becoming impatient and myself becoming impatient when patients have relentless questioning about their medical issues. So in closing, really, when I came into this, I had a feeling of not feeling nervous about people having information, access to all this information all the time. But as I read and sort of reflected on the situation, I think that I definitely see the benefits far outweighing any of the consequences to letting patients have access to that information. And it really will keep professionals more accountable for what it is that they're putting in the chart. So I really feel that this was a really good thing for me to look into, and will hopefully help me develop my practice in a different way. Thank you, everybody, for listening.